Well, we have been hearing about a number of incidents of domestic partner violence or intimate partner violence. A man in Richmond was charged with killing his partner on Friday. That is just the latest incident of violence resulting in a death here in BC. That comes just 2 weeks after James Plover in Kelowna was charged with the second-degree murder of Bailey Plover after a very public attack. Advocates are now calling on the province to declare intimate partner violence a public health crisis, and Cheryl Wellington is among them. She is a professor and vice chair of research at UBC's Department of Pathology and Laboratory Medicine. Last year, Cheryl and a team of researchers were awarded $3.4 million in grant money to study intimate partner violence. Now they're recruiting survivors to understand just how traumatic brain injury is linked to the issue. And for more, Cheryl joins us this morning. Good morning to you, Cheryl.
Good morning, Stephen. Thank you so much for having me.
Oh, thank you for taking the time. We do appreciate it. We have heard RCMP describe these cases as, in their words, isolated incidents. An independent review of the legal system's treatment of intimate partner violence says that the province should be declaring, in fact, an epidemic. Advocates say this is a public health crisis. As a researcher, how do you describe what is going on in this province?
It is a very much a public safety concern for me. Intimate partner violence is essentially happening every other day. This is easily enough to affect many people to the point where action really does need to be taken. I think one of the reasons that the RCMP describe it as an isolated incident is that a particular perpetrator is targeting a particular person and not randomly, generally not randomly looking to cause harm to the general population. I think it is the ways that different fields use the terms. However, when you consider that the number of intimate partner cases is very, very large. In 2022, there were over 117,000 cases of intimate partner violence in the province of BC. We know that women that are working or that are living in rural, remote areas are 4 times more affected, and they have fewer ways to be seen and report the issue.
I guess when police say that, when they call them isolated incidents, I mean, it does. I understand what you mean. It's, one perpetrator is targeting one person, but at the same time, does that not beg the question what's common in all of these incidents, where this comes from, why some men think this is somehow acceptable?
Oh, Stephen, this is a very complex and nuanced question. I think that there's a lot of normalization of practices that are damaging to women, a lot of misogyny that is rising. Um, we need to do better to raise awareness that these practices are not okay. And there's one in particular that is a particular red flag for a very likely or very greatly increased risk of death. Most people that have experienced a physical assault within the context of intimate partner violence have experienced assault to the head or neck. Now, this can lead to a concussion, just like a sport-related concussion or from. But what makes intimate partner violence different is that if there is strangulation, a lot of survivors will call this choking, but the medical term is strangulation. If this happens, this is another way that the brain can be damaged by cutting off the blood flow and oxygen supply to the brain. And we know records show that if a person has experienced strangulation, they are 700-fold more times likely to experience death. So strangulation is a major red flag, and this fact needs to be appreciated by the general public, especially as we're seeing a lot of younger girls and women, 16 to in their 20s, have an experience of IPV.
And so this is exactly what your study is looking at, the I guess diagnostic text to detect the potential impacts of that, well, essentially the brain being deprived of oxygen.
We are, a lot of our team is drawn from people that have been working on, say, blood tests for concussion and
Okay.
traumatic and other causes. So we are deploying these same sorts of technologies to survivors of intimate partner violence, having the experience of many types of brain injury testing along the way. And so what we're trying to do is enable if the results of our work will enable clinicians and emergency departments to potentially implement a testing regimen when somebody comes in with a potential complaint of intimate partner violence, to be able to collect evidence that is the brain involved, which is something that we don't do right now, and that could have potentially long-term consequences in terms of memory and other kinds of functioning for the survivor.
And so, given where the research is right now, or the study is right now, are you picking up on any trends or any patterns at this point so far?
We're very early in our study. However, the team has previously published, one member had a study that was conducted in Australia that showed that the testing results indicated a more severe type of injury from intimate partner violence than from a typical mild traumatic brain injury from a fall or a concussion. We had another team member that studied people that had successfully left a relationship and had a violent relationship and had memory testing done years after the incident. And what he found is that there were demonstrated deficits in memory that could essentially make the brain less resilient to further aging and potentially increase risk of a dementia diagnosis down the line.
Hmm. This study involves community based research, and Dr. Kim Stanton wrote a report on changes that the province could be making to improve outcomes here. And that report recommends more money spent on prevention and early intervention, even support for people who use violence. Based on what you have seen so far, where do you think resources should be focused?
Uh, there are a number of ways the Stephen, the question, it's a big problem. We need supports for the survivors. We need ways in which they can safely come and report and receive care. There was very recently a cancellation of a program in Nunavut, for example, where now people are left without the resources uh, to access
Hmm.
that existing program. We need better housing, we need more housing, and one of the things that our research is really trying to do is to enable frontline women support workers the knowledge that there might in fact be some brain injury associated effects for those people that are coming through. There are ways in which rehabilitation practices from other kinds of brain injury might be adopted into supports for women. There needs to be a lot more education among the general public,
Yeah.
the medical system, and along the judicial systems that IPV is much more common
Hmm.
than is and potentially has effects that we're really not looking at.
Cheryl, we'll have to leave it there this morning. Really appreciate the discussion. Thank you so much.
Thank you so much for having me.
All right, you take care. That's Cheryl Wellington, Professor and Vice Chair of Research at UBC's Department of Pathology and Laboratory Medicine.